You may have noticed that when your child says certain words, they may say the wrong sound or miss sounds out altogether. If your child is quite young, these little mistakes in their speech sound cute and sweet. It's because these errors are completely normal for toddlers and for young children as they learn to talk. Many children outgrow these speech errors. However, some do not, and they can start interfering with how well your child is understood. They can also impact on their spelling and their reading progress. So how do we know as a parent when our children should be saying the correct sounds and if we need to get them some help? Well, we at Words First are here to help you. Here is a handy little chart that you can download from the Words First website, and it shows you what sounds develop at certain ages in our children. So if we look at this chart, it shows us ages 2 to 7 years, and then it shows us at what age the sound should develop in words. In the beginning of words, the initial word position, in the middle of words, the medial word position, and in the end of words, the final word position. So let's take, for example, the sound D. If you look on your chart, you can see at the age of 2 years old, we are expecting D to be correctly produced at the beginning of words, like in dough. However, we only expect the D to be correctly said at the end of words, like in the word bed, by the age of 3. And then it's not until they are 4 years old that we expect to hear 100% clear production of the sound D in the middle of the words, like in the word cuddle. As you can see, speech sounds take a long time to develop and are only fully mastered by the age of 7 years old. So what do you do if you think that your child may need help with their speech? Well, at Words First, we recommend that a referral to a speech and language therapist is always first on the list, but we realize that this can be a little tricky and take some time. So here are a few things that you can do in the meantime. Find different ways for your child to communicate with those around them if they are really struggling to be understood. For example, they can point to a person or an item that they want, or they can lead you to that place or thing that they are talking about. Phrases such as, "Can you show me what you mean?" can really help your child see that there are lots of ways to communicate. Next, make sure that you have their hearing checked, as any difficulties with hearing, whether it's an ear infection, lots of wax, or a hearing loss, can make it difficult for your child to make sense of the sounds that they hear. And if they can't hear all the sounds, then how are they going to be able to copy them and use them correctly? We can also model sounds and words for them. While constant correction may cause your child to become frustrated and reluctant to speak, simply providing them with lots of clear examples of the sounds of the words that they find difficult can be a great way to help. Find words that contain the sounds that they struggle with and include them in everyday activities, saying the words clearly and slowly. Try to direct their attention to your mouth while you are talking. This can be done by lifting the object that you are talking to up to your face, or wait for the child to look at you before talking. We can also use a mirror. Most children brush their teeth twice a day, and often there's a mirror available for them to look in while they're doing this. This is a great time to get a few practices of a difficult sound in. So let your child imitate your mouth movement while you're saying the sounds, while you're both looking in the mirror. Another thing we can do is to highlight the sounds that they're having difficulty with by repeating them or making the sound a little bit longer when you are naming items. For example, we could go pop the bubbles, or this is a lemon. Don't do this all day long, as it's important that your child and you have normal conversations without the pressure of them feeling as though they need to be corrected, but use it when the opportunity arises. Most importantly though, don't push too hard, as correcting a speech sound takes lots of practice, so you need to keep this up for a long time. It's more important that your child feels heard and understood emotionally than making them reluctant to talk because they make a few mistakes with their sounds. For more information, please go to our Words First website and look at the resources available.